give us a little bit more of an introduction.
Thank you very much. So good morning, everyone, and welcome back to our third session with our Child Abuse Prevention Month speaker series. As Brent said this morning, we're pleased to welcome back Claire Anderson from Chapin Hall and Don Winstead from Winstead Consulting. Last week, Claire and Don shared with us the ways in which economic supports from sources like our public benefit systems and other programs could lead to improved outcomes for our children and families, as well as looking at how they might reduce child maltreatment and, more importantly, the impacts through an equity lens. They provided us with a look at possibilities that are worthy of our consideration and action, and it is my hope that it stimulated your thinking as you do work in this space. You will see some of the themes from the first session repeated here, but it will help you make connections to this session. So for part 2 today, we're shifting the focus a little bit to look at the sources of evidence and to focus a little bit on the Family First Prevention Services Act and looking at some of the services in the clearinghouse that might augment the economic and concrete supports that we're talking about. Looking at how we might maximize the federal law for a broader prevention vision, and more so looking at how we might elevate our federal and maybe state policies that can promote a system that impacts child and family well-being. And I am hoping that these sessions are providing added value to the work that many of you might be doing in this space, and that you'll continue to join us next week as we conclude this series with another panel discussion that will be moderated by Richard Connect. It will include some of these speakers and others, yours truly as well, to be part of that panel. So without further ado, I would like to turn the discussion back over to Claire and Don.
Terrific. Thank you so much. It's a pleasure to be here again this week with you all. We are delighted to be here. I'm Claire Anderson. I'm a senior policy fellow at Chapin Hall at the University of Chicago. And Don, I'd love for you to introduce yourself as well.
It's great to be back with you. I'm Don Winstead. I'm a consultant from Tallahassee, Florida, and I've worked for the past 11 years with many states, counties, and tribes, with much of that done in partnership and with the support of Casey Family Programs, which we certainly appreciate. And I, like Claire, I spent a little time with the federal government at HHS. I was in the Office of the Assistant Secretary for Planning and Evaluation, but most of my experience before going into consulting was with the state of Florida Department of Children and Families, working on a lot of the issues that we all continue to work on today.
Indeed. Thanks so much, Don. And yes, I too want to thank Casey Family Programs. We have been working in Los Angeles County and in the state of California for a number of years. And their generous support has helped us to understand some of the needs in California, but it also helped provide the space and the time for us to think through how economic and concrete supports might be helpful to families. So we're delighted to be here and to be working in California. So like Cheryl, I think you did such a great introduction of what we covered last week and its connection to this week. So I'm just going to launch in and remind us all that there's a lot of content here. We won't be able to go in depth in all of it, but the slides that you will see here are posted in a slightly earlier version at this link, and certainly the recording and these exact slides will be made available to you. As Cheryl indicated, we're going to spend a lot of time today sort of talking about the evidence of economic and concrete supports and its intersection with child maltreatment and family involvement with the child welfare system, and importantly, about child and family well-being. It's important to note that there are a variety of different kinds of studies here. We talked about this a little bit last week. We have some, a small handful of randomized controlled trials. Many of these studies are correlational or associations rather than randomized controlled trials, where we look at, one state takes up a policy and another does not. What happens? What do we see later in the data in child welfare? So I think it's just really important to note that there's a variety of levels of evidence here, and all studies are not equal. Similar to last time, when we talked about what happens when what does the evidence suggest happens when economic and concrete supports are removed from a family's life. We talked about a number of those studies. Today, we're going to talk mostly about studies where economic and concrete supports are increased in a variety of different ways. There are a number of, there we go, a number of studies that we're going to look at, though we will not look at all of them today. We've categorized them in sort of 3 different ways just to help us with the flow, given the number of them. The first set really is about economic and concrete supports that are integrated into child welfare type interventions like differential response. Then we're going to talk about concrete supports that sit predominantly on the public benefit platform, though not exclusively. And then about economic supports, macroeconomic policies like minimum wage increases, the earned income tax credit, and what we see thus far in the evidence of these policies. So we'll start out with differential response with concrete supports. This is a study that looked at low-income families who receive DR, who more typically are receiving concrete supports as compared to low-income families that are not receiving concrete supports. And those families are less likely to experience a subsequent maltreatment report. Family preservation with concrete supports. This is an intensive in-home service program where families with the open case, mostly neglect, received a concrete support averaging a little over $300 per family, were found to be less likely to experience a maltreatment report. Medicaid expansion, which California has done, states that expanded Medicaid compared to those that did not experienced a decrease in reported neglect. And we also see in continuity of eligibility for Medicaid and SCHIP is associated with a decrease in child abuse and neglect investigations. There are a couple of important randomized controlled trials related to housing. This one by my colleague Ann Farrell at Chapin Hall, Connecticut's supportive housing program, found that families who were involved with child welfare and facing housing instability, and they received a supportive housing program that included a voucher and case management, experienced fewer removals, a lower prevalence of substantiated maltreatment, and increased reunification. The family options study out of a HUD demonstration program found that families who were referred for a permanent housing subsidy, so not solely the families that were getting a voucher and case management, these families got the permanent subsidy. Those families experienced self-report 50% reduction in foster care placements after 20 months. Paid family leave. This is a California study. Compared to states with no paid family leave, the implementation of your 2004 paid family leave policy, which includes up to 12 weeks of partial paid leave, was associated with a significant decrease in hospital admissions for abusive head trauma among children under 1 and among children under 2. I just want to make a point here on this slide, and there are a few other slides where you'll see this as well. We often talk about this as about neglect, that economic and concrete supports have an effect on neglect because poverty and neglect are being conflated. It's important to note that we see an effect across a number of studies on abuse when economic and concrete supports are inserted or removed. And I think that's important to help us think through what the implications of the research are. High quality childcare, a number of studies here. We see over time and over several studies that high quality childcare can help prevent child maltreatment, reduce likelihood of involvement with child welfare, and reduce the likelihood of foster care entry. Child care subsidies. States with a more flexible child care development fund regarding subsidies for child welfare supervised children have on average significantly fewer removals than other states. And for each additional month that a low income mother receives a child care subsidy is associated with about a 16% decrease in the odds of neglect report in the following 12 months. Child care subsidies. This is a study from Hank Poles that was recently published in Pediatrics. I would encourage everybody to go and take a look at this study. We have another slide that has its primary findings. These data should be understood qualitatively insofar as the amount of money that it would take to achieve these results and the amount of decrease that we see here may be best understood qualitatively. So there's a real potential limitation there, but nevertheless, I think it's important to note that when they conducted their analysis on state spending, and if states spent an additional $1,000 per person in poverty on child care assistance, we'd see pretty potentially, again, understand this qualitatively, reductions in involvement with child welfare, foster care, and child fatalities. There are actually a couple of studies here about food insecurity. Children who participate in SNAP or WIC jointly or alone have a lower risk of substantiated abuse and neglect reports than children who are not participating in either program. And I find this study fascinating. This looked at a small northeastern state with rural, much rural areas, and the presence of each additional store accepting SNAP benefits in the least densely populated areas of the state were associated with an 11% decrease in substantiated child maltreatment cases, a 4% reduction in maltreatment reports, and a 6% reduction in neglect reports specifically. As you look at all of this evidence, I think there could be a number of mechanistic pathways here that are interesting. Reduce stress, trying to find food, having better nutrition, more disposable income in the pocket of the family because they are able to quickly and easily spend their money on food for the household. I think it raises many questions about the variety of interventions that we should be thinking about when it comes to supporting families with economic and concrete supports. This may be the first study I saw right as it came out in 2017 that caught my eye and now results in something like a lot of slides here, a lot of evidence. I got really intrigued by this finding, and it shifted my mindset tremendously about how I had thought about child welfare for the better part of literally 30 years. And I wanted to know more. This study is interesting insofar that this is a state policy choice. States that increased the minimum wage beyond the $7.25 per hour experienced a reduction in child maltreatment reports. And for every $1 increase in the minimum wage, there was about a 10% reduction in neglect reports, primarily for children under the age of 12. If nothing else, I think this slide for me really represents the ability to expand thinking and to dig into a body of science that is ever growing and has tremendous implications for how we think about what we do. There are few EITC, earned income tax credit studies. I won't go through all of it, but as we think about tax credits to families, or the ability to have a policy that allows for the provision of economic supports to families, I think we don't talk about those as prevention strategies. We talk about these kinds of policies primarily for the most direct result, that we're elevating income, that we are creating a tax credit. But we also might conceptualize them as child abuse and neglect prevention strategies. A $1,000 increase in income via EITC is associated with between an 8 and 10% reduction in self-reported CPS involvement. States with a state level refundable EITC compared to those without had 11% fewer entries into foster care after controlling for poverty, race, education, and unemployment. So that's a really interesting way to think about an upstream macro level policy and downstream use of foster care, and how we might understand our policy choices in ways that we have not previously. This last bullet, back to the physical abuse angle here, this study found that a refundable EITC averaging about $400 per year is associated with a decrease in hospital admissions for abusive head trauma for children under the age of 2. This randomized control trial is really interesting. I think it is one to pay attention to and to go back and review. This is a study that looked at a waiver demonstration project where all of the child support money went to the parent rather than an administrative component cut of that money to the state. And this found that for mothers who were participating in TANF and were eligible to receive that full benefit for their children, they were about 10% less likely to have a child subject to a screened-in maltreatment report. And even a modest increase in child support payments, averaging about $100 a year, results in a decreased screened-in maltreatment report in this study. We see a number of things about unemployment benefits, TANF. Actually, I'm going to go back to the TANF slide so that we can talk a little bit about TANF in California. A 10% increase in state public benefit levels for a family of 4 is predicted to reduce foster care placements by about 8%. This was looking at data from the 1990 to 1998 period, just as AFDC was transitioning over to TANF. And as we think about where are there policy opportunities or places to make decisions about how any individual program operates in a state, and orienting it around a core prevention strategy. I've been encouraging, both Don and I have been encouraging, probably Don first and me following his very good lead, have encouraged states to look at their TANF emergency funds, the trajectory of their spending in basic assistance, workforce, and childcare, and understanding that in the context of the evidence about child welfare involvement. Don, is there anything else you want to say about this slide in particular?
Well, I'll just say in terms of And of course, TANF in California is huge. Your basic state family assistance grant, I think, is about $3.7 billion. And California is one of the states that probably spends a higher percentage than normal of that on basic assistance to families, which is notable. The other comment I'll make, Claire mentioned the emergency assistance fund, and part of the American Rescue Plan, and we'll talk a little bit more about that later, was $1 billion in TANF emergency assistance, and California's share of that was a little bit over $200 million, so not an unsubstantial amount of money. That is for short-term assistance to families, not ongoing assistance. The key thing to say there is that money runs out September 30th of this year. And I don't know if California's had any difficulty spending it all. I know some states have, but as you look around, kind of look under the cushions of the couch to see where there's a few pennies here and there. This is not pennies. This is big bucks. So I think for those of you who have connections to the TANF program, is certainly something to explore.
Absolutely. Thanks, Dawn. Okay, let's talk a little bit about and transition to economic supports providing stability and improvements in mental health and well-being. Oh, there we go. So these are not focused specifically on downstream involvement with foster care or findings specific to reductions of child maltreatment. But if our theory of change around risk for involvement in child welfare involves mental health, overall stability of the family, reduction of stress, and well-being as a core prerequisite for reducing risk in involvement with child welfare, I think these studies are important for us at least to keep our eyes on. This, of course, is the Stockton, California Guaranteed Income Program, where residents were randomly selected to receive $500 per month for 2 years. And after 1 year, compared to the control group, we see improved financial stability, improved adult mental health, and improved employment, with high levels of spending on food and low levels of spending on alcohol and tobacco. The Eastern Band of Cherokee Indians casino dividend, every adult tribal member receives a yearly income supplement, averaging between $4,000 and $6,000. And we find improved child well-being and mental health, a decrease in behavior problems, as well as by age 21, tribal members are less likely to have substance abuse and psychiatric disorders than non-tribal adults in the same community, and improved educational attainment. This is also, there are lots of fun studies. This is a great study. This is a study of babies' first years that is among the first large-scale US randomized controlled trial trying to identify the causal impact of poverty reduction on children's early development. Initial findings in 1-year-olds whose mothers received about a $300+ monthly cash payment had brain activity associated with a higher cognitive functioning compared to infants in the control group. And one potential preliminary finding in the study was that the unconditional cash payment may have a causal impact on early childhood brain development. The Mothers Trust, the Magnolia Mothers Trust in Jackson, Mississippi, also an unconditional payment for 12 months. We see mothers having more money and enough money for food. They were able to pay their bills on time. They always had gas in their car, and saving money for emergencies. We see increases in the percentages from the baseline to the time of the study. Oops, let's see, there we go. The EITC expansion in 1993. Mothers with a high school degree or lower who were eligible to receive EITC and had 2 or more children reported larger improvements in mental health and reductions in stress-related biomarkers. And in Canada, where they had a child tax benefit implemented, it was associated with a significant reduction in depression for low-income mothers. We often hear concerns about if we provide an unconditional cash benefit to someone, or if we don't tie it to a work requirement, or it's a lot of money to a family, we've got concerns that that money will be squandered somehow on alcohol and tobacco, for example. We see in a couple of studies, the Stockton study that we just talked about, as well as the study in Canada, we actually see either very low use of those dollars in that way, or a reduction. And when we assess, well, what do people spend those on? We find meeting basic needs, education and school supplies, and paying down debt. Okay. One question that this raised for me as I was looking at a number of the evidence-based practices in Family First, and trying to understand where there might be ways to think about economic and concrete supports in that space, it really seemed to jump out at me that there are a number of well-supported interventions on the clearinghouse that have an economic support to the family integrated as a core component of the model, which I think leads to the question of, are economic supports more of an active ingredient than we realize? I do not have the answer to that question, but I think given the other body of evidence, it's interesting that these model developers, also looking at similar evidence, were wise enough to include economic supports as part of the model as a core strategy to reduce risk and reduce the entry into foster care. So I'm going to take a deep breath and turn the slides over to Dawn, and I'll keep clicking through for you.
Okay, and if you could go back just to the previous slide just for a second, one other point I wanted to just make there is, you know, the clearinghouse started off with not an awful lot of stuff on it, and it's slowly been building kind of at a glacial pace for some of us, but we now have 88 programs that have been evaluated, and of those, 40 something are either promising, supported, or well supported. We've now got 14 well supported programs on the clearinghouse, and the first 3 that are shown on this slide are 3 that California referenced in your initial application or prevention plan for Family First, the 5-year plan. Intercept, the Youth Villages Intercept program, is one that's recently been added. There are likely other well-supported as well as supported and promising interventions. where it would make sense to have a concrete support element to them. And so I think this is something that merits a lot more attention as we go forward. And I think Claire really, I think, suggests some really important potential avenues here as we explore this intersection between services, which are important, but also supports to families that are more concrete and help them deal with the stresses in their lives. The other point I wanted to say quickly and just to underscore is on unconditional assistance. For a long time, there's been a lot of debate as to whether or not people that receive unconditional cash payments are less likely to work. And what we're seeing with some of these studies is that's not the case, that actually it can remove barriers to employment because most people want to work not because government tells them they have to, but because that's a great way to get money and support your family. So there's I think a lot of interesting dimensions to this work. So next slide, and then the next. So just a couple of overall things about Family First Prevention Services and where we are with implementation. This map shows the plans that have been submitted and approved so far. There are 64 jurisdictions that are eligible to submit plans according to the Children's Bureau. That is, the 50 states and DC and 2 territories and 11 Indian tribes or Alaskan Native villages that are recipients of 4E and are actively implementing 4E. Of those 64, 44 have submitted plans, and of those 44 that are submitted, 22, as shown on the map, are approved by the Children's Bureau. Of the Indian tribes that are eligible, there's one in California that is up near the Smith River up in Northwest California. They have not yet submitted a plan, but they are eligible to submit a plan, and that is the Tolowa-Dini Nation up in Smith Valley. There's another tribal organization in Southern California that has a planning grant in place now currently for potentially getting 4E approval. So a lot going on there. Next slide. Now, say as you pursue approval of California's plan, just one thing we found is once you submit the plan, don't expect quick approval. As you are finding out, it is the start of an iterative process of dialogue and refinement that goes on for a while. The last 2 that were approved, Illinois and South Carolina, took a number of months to get to that status. In terms of how states can maximize the impact of Family First to transition in thinking in child welfare, and is I think we've tried to make the point over and over here, is that if you take and think about Family First as being business as usual plus this extra thing, then I think you're not going to realize the full potential. Family First really is an opportunity to use this significant change as a catalyst for rethinking how we work with families and how we work to support families as they raise their children. Some thoughts about how that can be maximized in terms of transformational impact. First, implementing motivational interviewing broadly and with fidelity. And Claire has worked very closely with District of Columbia and others, and we'll share some information about that as we go forward. Investing in culturally specific services. And I think we said last week that Casey Family Programs has recently put out a paper from their knowledge management area about some of the existing clearinghouse services that have been worked with different groups. And I know Chapin Hall has done work in that area also, but again, an important dimension. Building community pathways, and we'll talk a little bit more about community pathways, some ways to move the focus upstream to earlier than we might traditionally work with families. And if we haven't made a point yet about integrating economic and concrete supports for families, then we have failed. So obviously that's something that we're finding is an important dimension. And strengthening the alignment between child welfare, tribal nations, and partner agencies. And I think all of those are things that Family First gives us an opportunity to strengthen if we're going to maximize impact. Next slide. What are community pathways? Serving families outside of the child welfare system, perhaps creating entry points for families with no ongoing child welfare involvement, families voluntarily receiving services, and having 4E as an uncapped federal entitlement for services support that effort, which really is a paradigm shift in terms of how we think about our work with families. And we'll talk a good bit more about that broadly and as it relates to California. Next slide. So there are about 14 states. There's probably a state or two out there that would say, hey, us too, at least are thinking about it. But at least 14 states have proposed prevention plans that involve community pathways for prevention, and some have been approved. So this is not crazy talk. This is something that that a lot of states are thinking about, and some of the states that did not include that in their original plan are watching these developments very carefully to potentially do that going forward. Next. So I'm going to turn back to Claire, and she'll talk a little bit more about specifically California's approach to community pathways.
Yeah, and there are experts on the line that can probably do a much better job of this than I can. As much as anything, we wanted just to put in front of you the visual model that California has included in its Title 4E prevention plan that has been submitted to the federal government that clearly articulates a community pathway whereby families could be identified to receive services early and create a redesigned front end of child welfare, and more importantly, a redesigned family experience of child welfare through the provision of evidence-based practices and other supports in their communities and through organizations and agencies where they might typically go anyway, where they've built trust and the potential for an engagement that expands surveillance is by a CPS worker is reduced. So I would encourage everybody to take a look at the California prevention plan. And as Don said, there is a tremendous amount of energy and momentum across the country to try and look forward in implementing this policy, rather than looking backwards to the historical framework of child welfare that we talked about last time and that the Burns Institute talked about the first time. These are policy choices about looking forward and redesign that Congress has laid out for and created a piece of legislation that is really useful to understand a prevention paradigm with families. So I'm going to click through these quickly because I think I've said everything I needed to say on the first slide. Trusted community organizations and schools recognize family need. A community-based organization or a family resource center conducts an assessment to inform eligibility determination. The 4E agency, as required by the statute and the guidance, makes the determination that the family and the child is eligible for prevention services. And the CBO or the Family Resource Center actually develops the prevention plan and manages the case and is the conduit through which the evidence-based practices are provided. In Washington, D.C., there's also a community pathway articulated. It takes you will remember this was the first submitted and approved plan. So it takes a bit more of a traditional pathway for families where the hotline and the investigation would still occur. And a family would either be referred to in-home services within the child welfare agency, or from the investigation could be referred out to the community-based organization. In DC, it's the community collaboratives. A referral could also be made from the in-home case to the community collaborative for ongoing case management and family first services. Additionally, Connecticut has just been approved for its community pathway. So we now have 2 pathways that look very different from each other approved. In this instance, Connecticut plans on standing up a community management entity that would accept referrals, look at safety and risk, and identify strengths and needs, and create a recommendation to the agency around eligibility and the creation of the child-specific prevention plan. That eligibility determination, as we just said, would occur in the 4E agency, just like California has identified. It would be the same here. And then the community management entity would lead case management efforts and do ongoing service provision and referrals and monitoring of child safety. So several options here, and it's exciting to think about the kind of transformation that is starting to emerge. And I think that there are a number of ways for us to continue to iterate and elevate the momentum that we're seeing across the country. So Dawn, I'm going to have you talk a little bit about some of the federal policies, and over to you. And I think you're on mute.
Okay, thank you. So first, the impact of the 2021 federal stimulus check. So you remember what an exciting year 2021 was. Those of us who tracked a lot of federal stuff had to keep our slide decks very flexible because there was an awful lot going on. But material hardship fell sharply following the stimulus cash payments. Americans experienced significantly improved ability to buy food and pay household bills. And there was, in this study, improved mental health. Frequent anxiety and depression fell by 20% among all households. While economic recovery tax credits and other forms of aid also have contributed, the largest declines in measures of hardships coincided with the arrival of the stimulus checks. I think what we saw there was very consistent with what we had anticipated from the micro simulation modeling that we did in the National Academy study. Next slide. The impact of the monthly child tax credit payments, you can see there on the graph that 6 months of monthly tax credit payments reduced monthly child poverty by almost 30%, reduced volatility of poverty. That's an important measure too, because one of the things that builds anxiety, I think, is this kind of not knowing month to month where you stand. Increased the family's ability to meet their basic needs, and increased or reduced food insufficiency, and had no discernible negative effects on parental employment. Again, picking up on that theme that we've seen. The other thing, let me just say about the tax credit, just an editorial comment about tax credit, and there you go. And also the same comment about EITC, because you know, a lot of our workforce are young, and some of them aren't parents themselves yet, and may not know as much as we'd like them to know about the mechanics of the earned income tax credit and the child tax credit. So I think this is a real training opportunity, because these are things that that people really need to know in terms of their planning, and the more that we can share information with them from trusted sources, the better. Okay, next slide. The impact of enhanced unemployment benefits, you can see there, if you look at comparing households that applied for but did not receive the benefits versus those that did receive the benefit, on a number of dimensions about household difficulties, food insecurity, rent or mortgage payments, etc. Those that received the benefits had less bad things going on in terms of their financial circumstances, as well as fewer adverse mental health outcomes. This slide just shows the impact with improved mental health, decrease in the share of adults who reported adverse mental health symptoms overall. So, you know, it seems almost obvious as you think about it, but having a more secure financial situation for a family clearly is associated with improved mental health. Next slide. So the overall impact of enhanced government assistance during the pandemic, child maltreatment declined, emergency room visits declined, hospitalizations for abusive head trauma decreased, child fatalities due to maltreatment decreased, and so government assistance to families in financial distress may be protective, and so these supports, even though families overall showed some worsening financial environment, worsening financial environment, that the government assistance did buffer financial distress for many families.
And I'll just note that we do see an inconsistent finding that is alarming, which is an increase in child fatalities for Black children, a pretty substantial one there. And so I think that we all need to try and understand that a bit better, and perhaps differential understanding of what's happening here to create an overall reduction, particularly in abusive head traumas and all child fatalities. But what drove this increase, and I don't think we know yet.
Yeah. So if you work in Washington or work around the Congress and the administration, the thing you most often hear about a president's budget, and this doesn't matter who the president is or what administration, it doesn't matter what the makeup of the Congress is, the thing you most often hear about the president's budget is the term dead on arrival. The president's budgets don't get the attention that the president would like it to get often, but in the ACF portion of the president's budget for 2023, there were a couple of things I thought that were notable and worth highlighting. Not that Congress can necessarily take these up and pass it as is, but these ideas, I think, are very consistent with some of the things we saw with some of the pandemic bills that passed previously, and some of the ideas that have been discussed in the committees of the Congress that look at child welfare legislation. I think the other notable thing about child welfare legislation, as opposed to many other public policy areas, there is a tendency for child welfare legislation to be bipartisan and to get bipartisan support. And these are some I think, things that extend themes that we've seen in previous legislation. So at least things to watch out for. One of the proposals is to extend or expand 4E prevention services funding, largely by modifying the FMAP percentage for prevention services. We had in the during the pandemic legislation, we had in 2021 an expansion of 100% FFP for prevention services that some states were able to take advantage of. This proposal would extend that to the current year and then go 90% funding for prevention services FFP through 2026 and permanently set a rate of 75% or FMAP plus 10, which in California's case would be 75 because your FMAP rate is 50%. Make permanent the provisions that allow supported and well-supported to count towards the 50% requirement that current or will apply soon to well-supported evidence-based programs. Allow up to 15% of prevention funding on emerging services that is not rated by the clearinghouse, and also allow tribes with 4E agreements to have the same flexibility and cultural adaptations that 4E tribes currently have. So the tribes that currently are direct 4E grantees, they have the ability not to use the clearinghouse, but for the tribe to determine what culturally appropriate evidence-based programs are. But tribes that have state tribal agreements don't have that same flexibility. This would extend to them. Next slide. Second would be to modify the matching rates for children in foster care to give more higher matching rate for kin arrangements in foster care, as well as guardianship assistance to FMAP plus 10. And then family-based home will continue at the FMAP rate, but children in congregate settings, including QRTPs, would get FMAP minus 5. So there would be a reduction in the matching rate for those congregate settings. Except for the children in the family-based substance use treatment facilities would continue at the FMAP rate. Next slide. Just two others that were in there. One would be to increase CHAFE funding, and many of the flexibilities that we saw during the pandemic would be reinstated for CHAFE funding, and then also amend 4E to prohibit and provide financial penalties for discrimination by 4E agencies or contractors. So all of these are things that they're not law and may never become law, but I think certainly will be part of the conversation as Congress looks at child welfare proposals going forward. Next slide. So things that are available now, we wanted to highlight some of those things. This is not a comprehensive list because there's a lot of stuff out there. So this is sort of a sampler platter of some of the things that are currently still remaining from some of the prior enhanced funding opportunities. First is the supplemental funding, the emergency funding for the Mary Lee Allen Promoting Safe and Stable Families program. It was an $85 million program, and of that, $72,450,000 was for states and territories. And this the project period is through September of this year. So these funds, to the extent that they're unspent, are still available. The total amount, see, for California was $7.8 million was the amount of this for California. Unlike traditional safe and stable, no state match required, and a lot of flexibility in terms of how these funds could be used. So I know this is probably on people's radar, but at least another few months of potential availability of these funds. Next slide. The community-based child abuse prevention program, CBCAP, in the American Rescue Plan. This was a $250 million amount. California's share of that was just under $30 million. And unlike traditional CBCAP, this was available without the required community investment there. So this was available to states. You see there the approved activities, including assistance to families, comprehensive supports, all of those kinds of things. And this money is available. The legislation actually said, specified through September 30, 2023, but the Children's Bureau, in their guidance that they put out in the program instruction that's referenced there, makes clear that these funds are available through September 30, 2025. So there's a little bit longer lifespan on the use of these funds than traditional. Now, to say, in addition to this $250 million for CBCAP funding, there was another $100 million in CAPTA supplemental funding, and California's share of that was about $12 million. Same time period there through September 30 of 2025. Next slide. Yeah. A lot of other things, but a big one just to highlight is the state and local fiscal recovery funds. This was a $350 billion fund that came out, and it was split in Treasury split it into two tranches, half, and then followed a year later by another half. There were funds that went to the state. California's share of this was about $27 billion directly to the state of Florida, state of California. So, excuse me, forgot where I am. There's also a county allocation. Each of the 58 counties got an allocation, and that total allocation was a little over $7.5 billion. There's an additional allocation for what are called metropolitan cities based on the size, population of the city. And in California, given the size of your state, there was $7 billion allocated to 191 separate metropolitan cities. And then in addition, $1.2 billion for non-entitlement jurisdictions, that is smaller cities. And that money goes to the state to then parse out to smaller cities based on population, and the U.S. Treasury Department guidance on the population maps there showed that 291 smaller cities in California were potentially available for those funds. You can see on the slide the kinds of things that were potentially could be used for these funds. Each state developed a plan and for the use of these funds, and so just something to look at and see if there are opportunities in there, because this is a monumental amount of funding that went out. And in addition, additional amounts were for rental assistance, mortgage assistance, and things like that. So within that, if you particularly within those of you who are working within county settings, a lot of this money is going through and to cities and counties, and is really an opportunity to see if there are ways that these funds may be used to support families in your area. Next slide. And I think now I'll turn it back to Claire on describing some of the other state policies. Claire, you want to?
Yep, I'm going to take it away. And I'm also just going to piggyback on something that you said, or something I was thinking as you said. You know, when big policies occur, or our public benefits programs, we made this point last week, rarely, if ever, are they administered specifically as a child maltreatment prevention strategy, you know, with some level of intention, looking at your data to figure out which families are most at risk, where might they live. But policies like this and our public benefit platform, I think, could benefit from that kind of thinking, and that type of intentional administration. And so I think that it in some ways is part of the message here, not just that economic and concrete supports are important, but that when you look at any policy, that one thing to be really cognizant of is how might this policy be deployed with great intention to reduce the downstream, far more intrusive and far more expensive, both from a direct cost and an indirect human cost, for that type of government intervention that is foster care, which is incredibly important and necessary for some children. But the extent to which we have yet to conceptualize policies in the economic and concrete support space as prevention or intervention strategies, I think there are ways to do that perhaps we have not fully embraced yet. So let's look at a few states that are starting to think about their own state policies that are specifically related in the child welfare and economic and concrete support space, or that are designed specifically to promote a child and family well-being system that's consistent with how we've been thinking about things with you for the last couple of weeks. California, not surprised we have you all up first. You've just introduced a bill that limits the practice of billing parents for the cost of their children's foster care placement. A NPR investigation from last year found that 57% of parents who are billed for foster care in California are people of color, and the extra debt often follows families for years, as we know. When parents get billed for foster care, their children spend more time in foster care. We've shared a slide previously last week about that with you. In fact, the government raises little money and even sometimes loses money when it's trying to collect. So you all are at the forefront of limiting this practice. And this policy, connecting the dots to evidence, and the NPR investigation is an outgrowth of Dr. Kansian's study related to child support that we talked about a few minutes ago. You also do have an effective policy that continues cash assistance for families that are trying to reunify. So many states end TANF or other cash assistance when children are removed from the home. And California has a law that continues family eligibility for those monthly cash assistance up to 6 months to try and support reunification in an effort to not further destabilize the family from an economic standpoint when reunification is efforts are underway. There are likely many policies like this across the country and in California that when you start looking through this lens, you see them, in a way that allows us to take policy action differently than we might have otherwise. Kentucky is certainly doing that. They have a flexible fund available for families that are receiving family preservation services. And in this last state budget, the legislature created an appropriation of which the state agency has carved out $1,000 in flex funds available per family to try and avert removal from home. And even though they are increasing their spending in their prevention space by about $10 million over a few between state fiscal year 19 and 21, they are reducing their out-of-home placement costs through a combination of prevention, reduction of the use in congregate care, and a reduced number of children in foster care. So I think this actually sort of represents the promise of Family First. When you look at the original CBO scoring out of Congress, it anticipated a tremendous ramp up in prevention spending relative to spending in out-of-home care. And we are starting to see evidence of a state that is able to realize that intent that was articulated not just in the legislation itself, but in how the Congress anticipated the fiscal levers to work. Washington State, we see a few states beginning to change their neglect statutes, tightening the standards for removing children. In this instance, it requires CPS to show that a child is facing imminent physical harm rather than a serious threat of substantial harm. And it prevents the state from removing children solely because of certain conditions in the home, including community or family poverty, inadequate housing, mental illness, or substance abuse. And last time, you'll recall, we looked at state statutes in a map early on. This is a space where California does not have a similar policy as we understand it, limiting neglect as it relates to poverty specifically. Texas has a similar law. Parents must show blatant disregard for the consequences on the child for their action or inaction. And parents' actions must create an imminent danger of harm rather than a substantial risk of harm before a child can be removed from neglect. I'll share with you, I presented these slides in Ontario a few weeks ago, and their first question was, so as states are narrowing how the authority it has to remove a child from home if poverty is one of the root causes or is the driving factor, what policies on the other part of the safety net are they changing to make the context in which families live more stable and reduce risk? So it was a really great question. And I bring that up here to say that any one policy change is important, but it's the combination of policies, I think, that are going to have the biggest effect so that children are not left at risk, but rather the context in which they live is improved. Because we see that again, if we've not shown that yet, we have failed. Minnesota, a couple of states are expanding their right to counsel for parents, not just for parents whose children have been removed, but also for if they are involved with CPS, so that they have legal counsel from the very beginning. And we think that that is a policy that can enhance representation of the family's rights and put additional stopgaps in place for checks and balances. Let's see, that's similar. A couple of states have a variety of ways to resource families in Illinois. There's something called the Norman Fund that is flexible funding. So for families whose children are at risk of entering foster care, specifically due to poverty-related needs, emergency cash assistance is available along with assistance to find housing. And like California, it has a waiver allowing families to continue to apply for and receive TANF. Let's see, I'm gonna skip through a couple of these because I want to make sure that we've got time for questions. I'll highlight the Colorado Family Resource Center study, in part because family resource centers are integrated into your prevention plan. Family resource centers in Colorado connect families who've been screened out of child welfare to community and other resources, and can provide one-time financial assistance. And a formal partnership between an FRC and one county child welfare agency that's county administered like you are, saw a 63% reduction in its child maltreatment rate with an estimated savings of about $2.5 million. And like you, Indiana has integrated a community pathway, predominantly using Healthy Families America into its prevention plan. And we're all anxiously awaiting all of the plans to be approved, irrespective of the inclusion of a community pathway, because as we have seen through this slide deck, the provision of supports and evidence-based practices to families is critically important. And every day at this point that states don't have an approved plan in place, children and families are not getting critical services that they need to reduce their risk of being involved with child welfare and preventing their entry into foster care. And kids and families really can't wait to receive services that are critical to prevent entry into foster care. So excited to share a few of these state policies with you and to point out some opportunities that we think are available. Dawn, I think I am turning these slides, well, actually, I think these are mine too. So I'll just sort of briefly go through these and then let's open it up for questions. As you all well know, we spend a tremendous amount of money in the child welfare system and in downstream human indirect and personal costs, some of which can't be quantified. These are annual. I just want to point out these are annual costs that are accrued due to child maltreatment in the US, giving us a window into the potential for prevention. And we also do spend directly about $33 billion a year in child welfare, with only 13 to 15% of those dollars are usually spent by state on average in the prevention space compared to the out-of-home and adoption and guardianship space. In California, The estimated burden of child maltreatment is about $284 billion annually, and California is spending of that 33 billion we were just talking about $5 billion, 4.9 billion. 57% of that goes to out-of-home placements and about 11% on prevention services. We do see in a number of studies a negative return on the fiscal investment of foster care. About every dollar spent in foster care has a negative return of about $3.64 to a little less than $10. But we think that we think that there are alternative ways to begin to think about this, all the way from before a child and family is ever known to child welfare, and reorienting the upstream system and creating synergies across systems to help stabilize and support and strengthen families. Assessing for economic instability at all touch points in child welfare and long before, because Don pointed out this volatility in income or in financial stability in a household is really important. It seems in the literature, as we've learned, and understanding how to assess for that might provide us a different way of understanding for whom we might be reorienting our systems, and at what point might we be doing that. I think there's still a lot of research questions. There's a lot that we don't know, but I think that there is a lot that we do know, and beginning to assess economic instability is one thing that the literature seems to clearly support. Reordering public benefits, creating partnerships and collaborations, and blending and braiding of efforts. Once children and families do become known to child welfare, having a broad array of supports that include the evidence-based practices that address mental health and substance abuse and parenting, but pairing those with economic and concrete supports. Partnering with families and communities. I don't think we ask them about this very much. We ask them about what's their experience with CPS and what should we do about it. But we don't ask them about this. At least that's been my experience. And I think we could and we should, and certainly evaluating any changes that we're making so that we deeply understand what works and what does not. So I just want to thank you. Our contact information is here, and I'm going to stop sharing my screen and turn it back over for questions and answers.
Thank you, Claire. Thank you, Don, so much. It's just also, again, another reminder of if we could reinvest those dollars into prevention, what would that look like? We could be spending in early education, or we could be spending in higher education. We have many opportunities in spending in infrastructure and building our systems of support for all our families. So it's a great ending, and thank you for building those connections for us throughout this presentation. So with that, let's start out with our Q&A. So I'll share some questions. So one of the first questions we have is by Sheila. In the initial programs, has there been included in these studies the comparison costs of providing the services versus the cost for reports and cases?
I think that last return on investment slide gives us a window into the return on investment that you get with foster care, for example. It doesn't fully answer the question, but the costs in the back end of the slides, I hope was helpful. Don, you have any additional, I'm sure you do, on this question, thinking?
Well, I think, we're still early days. And as Claire said, there's only a small handful of states, only about a dozen states have actually claimed any prevention services so far. And there's only 2 or 3 or maybe 4 jurisdictions that have made substantial claims. So this is still developing, and I think we're going to have to see. I think one of the cautions that I've tried to encourage states to look out for and counties as you go forward. Spending funds to provide prevention services to reduce entries into foster care will work programmatically, and it will work financially to the extent that it actually reduces entries into foster care. If you spend money on prevention services and don't prevent entries into foster care and don't do it effectively, then that's going to be difficult to sustain. So I think having metrics in place as we go forward to look and make sure that we're getting the desired outcomes is something that's going to be important to do as we go forward.
Is there anything in place to connect parents or guardians with mental health supports or substance dependency support in child maltreatment cases?
So Family First is oriented in exactly that way. All of the states that have approved prevention plans are standing up those services presently. And in California, you have put forth a set of evidence-based interventions that are designed to do exactly that. Now, of course, in California, you all are building on tremendous existing services that many of which show up in your prevention plan. So there are services in place. It certainly is variable by county or jurisdiction. But I think at the core, Family First is designed to ensure the availability of mental health service, evidence-based. I actually want to be very clear and make sure everybody hears me. Evidence-based mental health prevention and treatment services, substance abuse prevention and treatment services, and in-home parenting skills programs. So those are the allowable services currently. And we're very much excited about states going forth and making those deeply available to families.
Thank you, Claire. And just as a reminder, as Claire had mentioned earlier, California has submitted a 5-year state plan, and within that 5-year state plan, we've selected 10 well-supported practices, which across the spectrum include mental health, substance abuse, and in-home parenting preventative services. And so with that, the next question, compared with many other states, California has already many family-friendly policies in place, but does not necessarily show the expected outcomes. Can you elaborate as to why you think that is what we are seeing, and what can California do differently as policies are implemented?
I don't know that. First, I would say that you're not seeing the outcomes. The paid family leave study is a really great example of seeing a reduction in abusive head trauma. So there may be an effect already in California. You do have quite important expansion of some of the policies that we talked about. I think it would be very interesting to try and understand the extent to which there's a shared strategy across the state and across those program areas, whereby people are with great intention thinking about reductions of child maltreatment and preventing involvement with child welfare. I think that there's some really great research questions that were implied in the question as asked, because I think we do want to know more about like for whom and how much and when, because I think those questions are not fully answered.
I think also that having a county operated system gives you a real opportunity to collect that outcome data and to ask the question comparatively. How come the outcome in this county is different from the outcome in that county? What are we, and the opportunity to create a learning environment where you can learn from from one another, as well as what's happening in other states. But I think one of the real advantages of having 58 counties doing this is the opportunity to learn lessons from one another. The other thing too is that we all know is this is difficult work. This is really hard stuff. And so, the opportunity for silver bullets in here is really hard to find. That even when we do our best with resources and all, it's still hard because what's happening with families is hard. But I think the more we can track outcomes, the more we can pay attention to evidence and build the evidence base and learn, then the more we can answer that question in terms of guiding better ways to do the work that we do.
Thank you, Dawn, for acknowledging that piece. It is hard for families. It is hard for our direct service providers. We have a lot of work to be done, and I appreciate you acknowledging that part. How can I receive the slides for this presentation? So that question has come up a few times for us, and just to let you know, by the end of the week, we will be sending out the slide deck with a copy of the recording. So everyone should be receiving that, we hope, by the end of the week. And one final question in the chat. Okay, so what makes a tribe 4E eligible?
Okay, so to be 4E eligible, the tribe has to go through an extensive, submit a 4E plan and go through an extensive process. There are 4E planning grants that are available to tribes. A lot of these grants, some of them have been 5 years. The more recent ones are 3-year planning grants where the tribe gets an allocation of funds to support their planning efforts. There are, I think now 17 tribes that are 4E direct funded tribes. One, as I said, in California that is direct currently, and one other that's in the planning process. But you have to go through all of the states, all of the things the state would go through to be 4E and to submit, your 4E plan and your cost allocation plan and all of those things. But there is information on the Children's Bureau website under the focus areas. One of the focus areas is tribal programs, and does link to the information about the planning grants if a tribe is interested.
Thank you, Dawn. So that was the last question in our Q&A session, and we're just at 12:30. So we wanted to just thank both of you once more. Thank you so much for our attendees today for participating, and then of course to Claire and Dawn for the presentation. It was extremely engaging, and we hope to see everyone next week. As Cheryl, our branch chief, mentioned, that next week we will be having a panel discussion with our speakers. This includes the Burns Hayward Foundation, and then as well as Claire and Dawn, Claire from Chapin Hall, and Dawn, I'm sorry, actually Yasmin will be joining us from Chapin Hall, and then Dawn from Winston. We appreciate all of you and have a good afternoon. Thank you.
Thank you, everyone.
Thanks so much.